Okay, so continuing, previously we were talking about the attachments and relations. The anterior tubercle provides attachment to the anterior longitudinal ligament. And also, previous to that, I told you that since right now we're talking about atlas, this doesn't have a body, a vertebral body. It doesn't even have a spinous process. But the remaining vertebrae, aside C1 and C2, the remaining, they do have a vertebral body. So from the interior portion, the upper and lower border, that gives attachment to the anterior uh, longitudinal ligament, and the posterior border of the vertebral body, its superior and inferior surface, upper and lower border, sorry, upper and lower border, it gives attachment to the posterior longitudinal ligament, right? So right now, since this doesn't have the vertebral body, we are taking the anterior tubercle. So that gives attachment to the anterior longitudinal ligament. And this anterior longitudinal ligament, for example, if it's here, so on its sides, we'll have longus colli muscle, right? And then I also told you that the posterior surface of this anterior longitudinal ligament, it has two or more foramina. Through this, your basovertebral vein passes through, right? And yeah, that's pretty much it. Uh, the next point says that the upper border of the interior arch. So where's the interior arch? We can see. Can you see it here? Yes, right here. So the interior arch, upper border gives attachment to the anterior atlanto-occipital membrane. Anterior atlanto-occipital membrane, and the lower border of the interior arch gives attachment to the lateral fibers of the anterior longitudinal ligament. So anterior longitudinal ligament is also attached, but towards the lower border, and towards the upper border you'll have the anterior atlanto-occipital membrane. So you can see the anterior atlanto-occipital membrane right here in this diagram. Uh, I just saw it here. Yep. See, interior atlanto-occipital membrane. That's here. So this is the vertebrae, cervical vertebrae. So its interior arch, its upper border gives origin to anterior atlanto-occipital. Its lower border gives origin to anterior longitudinal ligament. Very important. It's clearly evident here, right? So don't forget this region. Now moving on, the third point says that the lower border. Okay, we're done with the third point as well. Then the fourth point says that the posterior tubercle provides attachment to the ligamentum nuchae in the nuchae or nuclei or whatsoever in the median plane and gives origin to the rectus capitis posterior minor on each side. Now the posterior tubercle. Let me show that first to you here. This is the posterior tubercle. This provides attachment to ligamentum nuchae. And can you see that ligamentum nuchae? Yes, right here. So if this is the posterior arch, right behind the posterior arch, there will be posterior tubercle. So that basically gives attachment to the ligamentum nuchae, right? And then the next point says that the groove on the upper surface of the posterior arch is occupied by the vertebral artery. So on the upper surface of the posterior arch, so this is the posterior arch. I told you that there is a groove right uh, close to the what do you call this, lateral mass. There was a groove which was occupied by the vertebral artery. So that's exactly what they're repeating again. And let me show that to you as well. So this is the vertebral artery. So this is the posterior arch, and you can see there's a groove. This groove is there for this vertebral artery, and behind the groove on the upper surface of the posterior arch is occupied by cervical vertebrae and by the first cervical nerve, by the first cervical nerve, right? So that's what they're saying. Behind the groove, the upper border of the posterior arch gives attachment to the posterior atlanto-occipital membrane. So behind the groove, it also gives attachment to the posterior atlanto-occipital membrane. So we covered the ligamentum nuchae. It arises from your basically upper surface of the posterior arch, and then basically the posterior tubercle. Sorry, posterior tubercle. Yeah, that gives attachment to the ligamentum nuchae. Then the upper surface of the posterior arch, there is a groove that is occupied by a vertebral artery and the first cervical nerve. Then they're saying that after this groove, there is also attachment site for the posterior atlanto-occipital membrane, and the interior atlanto-occipital membrane was on the anterior arch upper border. Lower border was anterior longitudinal ligament. Now, the lower border of the posterior arch gives attachment Now the lower border of the anterior arch was for anterior longitudinal ligament. Not similarly, and lower border gives attachment to the highest pair of the ligamenta flava. So here you can see that the lower border of the posterior arch, it's for ligamenta flava. Lower border, ligamenta flava. Now, the tubercle on the medial side of the lateral mass gives attachment to the transverse ligament of atlas. So there was a tubercle that we couldn't find on the medial side of the lateral mass that gives attachment to the transverse ligament of atlas. Right now we're talking about the atlas. So yeah, where is the transverse ligament? Here. So this is going to attach on the tubercle on the medial side of the lateral mass. Now moving on, they're saying here that the anterior surface of the lateral mass gives origin to the rectus capitis anterior. So that's a muscle which gets insertion on the lateral mass anterior surface. The transverse process gives origin to a lot of other muscles, and that's pretty much it about the osteology. So if there's anything that I didn't cover, or if you're confused between, so this is the vertebral artery, that's a groove on the posterior arch. Inferiorly, you have ligamenta flava. Superiorly, you had the posterior atlanto-occipital membrane, and yeah, posterior atlanto-occipital membrane, ligamenta flava. Inferiorly, there was a groove, and then the tubercle gave origin to the ligamentum nuchae, attachment to the ligamentum nuchae. Then anterior arch, superiorly, you had the anterior atlanto-occipital membrane, right? Anterior atlanto-occipital membrane, and here there was posterior atlanto-occipital membrane, and inferiorly to the anterior longitudinal ligament, right? And then body also I told you already. And this is the articular facet, The inferior, it points interiorly, right? Forward, it's directed forwards and downwards. The superior, it's directed backwards and upwards.